We're very pleased here at Bodysight.com to welcome Dr. Jeffrey Life. Dr. Life is the 2007 recipient of the first AMMG Alan P. Mintz MD Award for Clinical Excellence in Age Management Medicine. He was the former Chief Medical Officer of Thermogenesis Medical Institute and ended his association with them on March 1st of 2014. He is board certified in family medicine and is a diplomat of the American Board of Family Practice and a fellow of the American Academy of Family Physicians. After receiving his medical degree from the University of Iowa, Dr. Life completed his residency in family medicine and internal medicine at West Virginia University. He also attained a PhD in environmental sciences and health at the University of Michigan. During his career, he was a full-time family physician and a part-time assistant professor at Marywood University in Pennsylvania, teaching graduate courses in nutritional science and exercise physiology. In 1998, specifically after reaching a lifetime high in his body weight and percentage of body fat and level of deconditioning, he decided to enter the EAS National Body for Life Challenge at age 60. And most of us know about Body for Life. Well, he won the contest and became a grand champion and has continued to live a lifestyle promoting health and fitness. His own book, The Life Plan, was released in 2011 and became a New York Times bestseller. His third book, The Life Plan Diet, was released in 2014. Men's Fitness selected him among movie stars and athletes in their 20s and 30s as one of the 25 fittest guys in 2012, but when he was 74 years old. And he's appeared on Inside Edition, The Dr. Phil Show, The Doctors, Anderson Cooper's AC360, The Steve Harvey Show, and others that can be viewed on his website at drlife.com. So welcome, Dr. Life. I know it's a long intro. I appreciate Julia for putting that together for us. It's a very distinguished background, very relevant to what we're talking about tonight. And I think that one of the things that we want the providers who are tuning in tonight to learn about, because there's a lot more to you than just being a doctor. What made you go into medicine in the first place? How did that start out for you?
Well, it goes way back to when The Fugitive was on TV, and I was just a kid, and I really became engrossed in that whole TV series. And this doctor is being chased, and everywhere he goes, he does good things for people. And I said, I really think that'd be a great profession. Well, then I got out of undergraduate school and went to graduate school in pursuit of a master's degree in physiology and pharmacology. And then later went ahead and got a PhD in environmental toxicology. I still could not get this idea out of my head of becoming a physician and practicing medicine. I mean, I liked research and I liked writing and all that, but I really wanted to take care of people. So I ended up having an opportunity to go to med school. I was the oldest medical student in my class. I was 33, which is very common now. Back then it was very uncommon. And I graduated from the University of Iowa and pursued a residency in obstetrics. After the first year, I switched over to internal medicine and family practice. And that's what I've done ever since. And I practiced traditional medicine up until about 10 years ago. And I was really disturbed by where medicine was going. It was becoming, we were able to spend just fewer and fewer minutes with our patients. We were under the gun all the time to follow insurance guidelines and get insurance okays to do procedures that we knew were vital. And at that time, I learned about Thermogenesis. I'd already won the Body for Life contest. And even after I won it, I got a lot of people that wanted to do that with me, but I just didn't have time. It's hard to do, teach people lifestyle in 5 and 6 minute office visits. So I took the opportunity to join Thermogenesis, and they were the pioneers then in age management medicine. And that's how I got into this whole field of preventive medicine, being proactive about preventing disease. Which really focused on exercise and nutrition and hormone optimization. I became their chief medical officer, and I became really interested in the area of heart attack and stroke prevention. For my own personal reasons, I have heart disease, and heart disease kills more Americans than anything else, men and women. It's the #1 cause of death for men and women in this country. And it seems like if we're going to pursue a lifelong effort to reduce disease and improve quality of life, we need to target heart disease. And so that's what I've been doing for the last 10 years. And I've worked with Brad Bale and Amy Doneen. They have the Bale-Doneen method. And this is way out of the box. This is all about looking at the root causes of vascular disease, which leads to heart disease and strokes. And so I've become part of their whole program, and actually am a patient of theirs. And they've literally saved my life by being proactive about aggressively going after the root causes of vascular disease. Traditional medicine, traditional cardiology in America really waits until something bad happens. And then we're really good at fixing it if you survive it. Really good at putting stents in and bypass surgeries. But once the stents are put in, you go back to your old ways, and the recidivism that is huge. People end up getting more stents, more bypasses. And so I'm all about getting in there and stopping the progression of the disease and reversing it. And so that's what I've done for myself and my patients, and that's what I talk about in my books, and especially my first book. And so that's what I focus my practice on. I left Cenegenics at the end of 2013, and then decided to move from Las Vegas to Charleston, West Virginia, where my son and his family live, and I want to be closer to them. And so I opened up my small practice, concierge type practice in West Virginia, and have continued to do what I do, and it's working out all right. I thoroughly enjoy what I do. It's not a job, really. It's just something I like to do. And I'm thinking about writing my 4th book, and that's about where I am now. I've continued to incorporate exercise, nutrition, some pharmaceuticals into my whole program, my personal program, and I've been able to dodge a lot of bullets as I've aged. I'll be 80 at the end of this year on Christmas Day, and I want to keep this going as long as I can. So there you have it, John.
Well, your personal story is a testament to how important it is for people to be proactive and preventive. But I'd like to, if it's okay with you, ask you a couple of questions about the shifting paradigm in medicine. And I know that there are mostly providers that are going to be interested in listening to this presentation tonight, but individuals will listen to this too. And I think that what people don't understand is that there's also, beyond your caring, and I can feel that you've got a deep sense of caring about the preventive medicine paradigm and the root cause movement. There's a financial model that's also involved here, and I'd like for you to speak to that. You mentioned that doctors are spending and have been traditionally spending less and less time with patients. There's this crunch, right? And I think it's driven by reimbursement issues. It's driven by the pharmaceutical incentives that we have. What do you think it is that has caused doctors to feel the need to spend less and less time with patients, and as a result, give them less advice rather than more? Is it just a matter of getting less reimbursement, so you have to see more patients and give them less time per patient?
I think physicians have allowed the insurance industry to take over and control what they do. I mean, I don't see this so much in veterinary medicine. I don't see it in dental medicine, but in MDs and DOs, we are victims of the insurance industry. We are controlled by them. And when I was doing traditional medicine, if I'd see a patient that I knew needed a CT scan, or let's say a stress test, I would have to get on the phone and argue with someone from another country that would make the decision about whether that test was allowed or not. You just have to jump through so many hoops to get the testing and the lab testing that is needed to take good care of people. And this results in doctors having to spend, traditional doctors like my son, having to spend a lot of time on dealing with jumping through the hoops to get things approved, to document in their medical records all that's needed to get the insurance companies to pay for these tests. And so my son is a typical example. He's a family practitioner in West Virginia, and he spends hours documenting, putting information into the medical records, and dealing with insurance obstacles. And he's able to see maybe 20, 25 patients a day, and he tries to spend adequate amounts of time with them, but 10 minutes, you got to move on. And so it's become an absolute nightmare. That's why I got away from the insurance business, and I do not use insurance. I'm private pay, and that works so much better. I get to spend as much time as I want with my patients, and I give them my cell number, and they're able to contact me whenever they have a question. If I want to talk to them, I end up talking to them through Zoom or some other way like that, or they just come back and see me. So it works out really well.
So the cash pay model then, is probably you're seeing fewer patients, but overall you probably feel like you're making a greater overall difference because the people that you do see, you're actually making a significant change in their lifestyle. Is that right?
That's absolutely right. I mean, that's what I focus on is their lifestyle, and I get periodic labs on them to make sure that what we're doing is working, and they can see the actual proof in their labs. And I'm going to start getting carotid ultrasounds, which will show regression of plaque or change in plaque in their carotid arteries. And this is how people make changes and reverse their downhill course of ultimate death from a heart attack or a stroke.
And so is it, one of the things we wanted to talk about tonight is that you've also created a new program called the Dr. Life's 30-Day Body Transformation Program. You're using the BodySight app to help disseminate that. And I'm assuming that this is part of the movement towards getting more people into a program that they're essentially partnering with you and they're paying you to help them, change their life and not just, take medicine. Tell us about that project and, why you wanted to create your fitness program and how you're encouraging them to follow this program using the technology and the content that you've created.
Well, an absolute key to healthy aging is doing the right kind of exercise. I mean, if people don't exercise, they are going to age more quickly, and they're going to get diseases that they don't need to get. So there are two absolute keys to healthy aging, and that is eating the right foods, putting the right things in your mouth, and exercise. And the kind of exercise that's really needed is resistance training, so you don't lose muscle mass as you age. It's the loss of muscle mass that's called sarcopenia. Turns out to be the number one cause of people being admitted to nursing homes. As we age, we tend to lose muscle mass and become frail and unable to carry out our activities of daily living. And our kids just can't take care of us anymore. They say, well, we're going to put you in this home for a little while, Dad or Mom, and they're going to build up your strength, and then you can come back. But that never happens. But now we know that you can exercise with weights and resistance training and cardio, and you can not lose muscle mass. You can actually gain muscle mass as you continue to age, and avoid all that, and have a great quality of life as you get older and older. I think that my deal is that the second part of your life should be the best part of your life, not the worst part. And so that's what I focus on. So I've always wanted to create an app or something that people could use to see what kind of exercises I do. And it's not rocket science. It's really pretty simple. And so ever since I won the Body for Life contest, I wanted to put something together. And so I had video footage taken. And then Julia Mills, that works with me, found BodySight. And BodySight has helped me create an app that is my 30-day program on how to get fit and stay fit as you age. And it's just really worked out very well. I'm very happy with it.
Well, that's great. And I'm curious, I know that you are an advocate for, continuing this type of a lifestyle well into, your 70s, your 80s, even your 90s, I would imagine. What's the demographic of your patient base? Do you have people in their, 20s, 30s, 40s are also following this? I know that people even, we see a lot of people coming through our system that are young and overweight and out of shape and at risk for cardiac disease because of their lifestyle. What's the range of people that you're addressing right now? Would you say it's across the whole board?
It's pretty much across the board. I would say my average patient is about in their mid 40s, but I have some in their 30s, and I have 2 or 3 that are in their 80s, but the bulk are in their 40s to 50s, and some in their 60s. It's best if people start this early. People start in their 20s and 30s and incorporate this into their lifestyle, and then they just breeze through the aging process, and that's the ideal. But I get people that have devoted their lives to their careers and their families, and all of a sudden they realize that they are hugely successful financially. They love their careers, but they've let their health go. And so they say it's kind of like a wake-up call, and they say they've got to do something, and we've got to make changes. So I get a lot of men, mostly men, and some women that really want to turn things around. And that's where my app really helps them. I want to create more apps, but this app on the exercise really is a great starting point.
Yes, and that's one of the things that we like to leverage with providers like you, is that with BodySight and the platform, we're content agnostic. So we encourage you and everybody else that uses it to build programs of all types, mindfulness and lifestyle change, and even recovery from various conditions. One of the questions I had, Dr. Life, was to share a little bit more about your Life Center for Healthy Aging and what some of the main areas are of focus when you're treating patients. And when you address that, I'd love for you to talk to the doctors and other healthcare providers that are listening to this about some of the practical aspects of practicing in a cash-based model. Like moving from the crunch of trying to see more patients than is feasible, just because you're only getting paid so much per patient, to a model where you're charging more, but you're certainly giving tremendous value for that, and the patient and your practice are both winning because of that. So if you want to incorporate that, I'd love to hear that for the providers on how you're succeeding in that model.
Well, when I was with Thermogenesis, we just did cash, a non-insurance based medicine. People would pay an annual fee, and so I've continued that model. So it was pretty easy for me to just continue it. For someone that is in an insurance-based medical practice, it is harder to switch over, and there are organizations that help with that. Brad Bale and Amy Doneen run the Heart Attack and Stroke Prevention Program, and they are helping doctors get out of the insurance model and get over to the cash fee-for-service model, and they help doctors do that, and dentists. And I think you can, if you're a Medicare provider and you're providing things that Medicare doesn't cover, then you can legitimately bill outside of that Medicare plan. But I'm not real familiar with exactly how to go about doing that. But there are people around and organizations that can help doctors switch over. And if you're in an insurance-based business, then you need to make that transition slowly. Otherwise, you're going to have a sudden drop in your income. But believe me, it is absolutely, once you've made that change, it changes everything in terms of your lifestyle, your happiness. You don't have to deal with insurance companies. I tell my patients, I spend lots of time with them. In the first visit, we spend 6 hours to 7 hours. And then from that point on, I talk to them as often as they want. And I give them as I said, I give them my cell number, and no one really abuses that. And so it's a totally different relationship. The people that come to me are coming to me because they really want to make changes in their life. And that results in a different kind of patient that's very, very easy to work with. And that's the ideal patient. When you're working with insurance in an insurance-based model, patients seem to have the idea that they have a right to do this, and they are very demanding. And if the outcome isn't, and if they don't participate in it, they don't participate in their health. Whereas my patients know that they are participating in their health, and I just help them. I'm their sort of their coach or their guide. And it's a whole different way to practice medicine that is wonderful. I mean, it's truly wonderful.
Well, I've heard from a lot of doctors who are still in the insurance type of billing situation or transitioning that, and this is again, as you mentioned earlier, one of the vagaries of the insurance-based incentive system is that the encounter between the doctor and the patient, or the provider and the patient, is often like a collision rather than a partnership or a participatory relationship. And one of the reasons why BodySight has been serving the providers like you so well is that you have a sense of wanting to give more to the patient without having to give your own left lung every time that somebody has a question, even though you make yourself available. And you mentioned that the patients don't abuse the privilege of having your cell phone number, and part of it is because they know you're there. And I've got another example, not to take away your thunder, but I've got a really great nurse practitioner in Atlanta, Georgia, who focuses primarily on helping women who are obese, grossly overweight, to regain the power over their lives. And one of the things that she likes about using the approach that you're talking about is that she basically sells herself as being available 24/7. She tells her patients, listen, I'm always available to you. Call me, text me, message me through BodySight. I'm always there. But because she has a system like you do, where she's actually talking to them on a daily basis throughout their program, they don't feel the need to abuse it, because they're almost like with her. I think that that's what you're conveying to us, is that your patients kind of feel like they're part of your family, and that they know that you're there for them anytime that they need you. And so they're not feeling like they have to call you, because they know that if they need you, you're actually there. So that's an approach, I think, that whose time has come. And it's great to see you, espousing the benefits of it. So what's next for you? I mean, where do you see this going for you in your practice? And are there expansions coming and other topics, or what's next for Dr. Life?
Well, the next big thing I'm going to do is in November. I'm going to become certified through Cardio Risk, so I'll be able to do carotid ultrasounds in my office and measure the thickness of the intima media and look for plaque in the carotid arteries, which directly correlates with plaque in the carotid arteries and the cerebral arteries. And it's a really great way to assess people's risk of having an event. This tells me not only if they have plaque, it will tell me whether that's dangerous plaque or soft plaque, which is dangerous, versus calcified plaque, which is not dangerous. And then I can follow my patients. I have them back in 6 months or a year for a repeat carotid scan, and can see improvement. or not improvement if they're not following what they need to do. And so this is a really great tool that has really been helpful for me personally, but I'm going to incorporate it into my practice so I can do that with all my patients.
And is the exercise component and the dietary changes that you are participating in yourself and recommending, are those reducing the risk factor of the carotid artery and the plaque for people in all age ranges?
Absolutely. So I have two big things that I'm really serious about, and that is to do something every day, to exercise in some way or another every day. And people just don't move around like they should. Although they move around here in New York, you don't see people driving cars here, which is really good. I've put in 5,000 to 10,000 steps a day since I've been here. But most people do not move around, and they don't exercise, and they don't stretch. They don't do any flexibility training. So I'm really big on all that, and it doesn't have to occupy a ton of time. Just an hour to hour and a half a day of formalized exercise, and you will be amazed at the kind of gains you can make and how it impacts in a very positive way the aging process. And the other thing I'm big on is that, whatever you put in your mouth can either hurt you, I even say kill you, or heal you. And if we look at everything that we eat or drink in that light, it really changes our choices. And if people just did those two things, we would reduce disease tremendously. And then there are other things. I'm all about reducing oxidative stress, which helps reduce inflammation. And so I talk about that in my website, and I incorporate that into my practice.
I wanted to ask you how you feel about the concept of things that we do outside of our resistance training workout. I like you have always been a big believer in having a certain set of minutes every day where you actually dedicate some time to exercise, whether it's resistance training or high intensity interval training. But there's this concept that's been around forever, but people don't really adopt it often enough because we're always sitting at our desks, of the non-exercise activity thermogenesis, or NEAT, where we basically focus, get up, walk around, stand at your desk. How do you feel about that as far as it impacts the plaque and the carotid artery? Is that significant, or is that just one piece of the puzzle to be moving around throughout the day?
I think it's one piece of the puzzle, but yes, it's for sure significant. I mean, people in this day and age sit and watch their monitor. They don't get up and move around. If you have a desk that makes you get up, or that you can raise up and stand for a while, it really, just moving around just makes so much difference. So that's what I incorporate into my practice here.
I have, if you want to bring up anything else, I'd love to have you do that independently, but I have a couple of questions, and one of them was something that was submitted that basically asks how you incorporate an executive health plan into the concierge clinic. I don't know if that makes sense in without more context.
Well, that's what I do. I mean, I do an executive health program. Well, okay, I have them pay a flat fee up front, and then that covers them for a whole year of my services. And
So that's one of the offerings, the executive health plan.
Yeah, and well, that's my only offering.
Right. So that's the way that it's priced, and it's basically you get the whole year, and you're at their disposal for the entire time of that term,
That's
which
right.
beats the heck out of traditional insurance. I've got insurance that gives us basically nothing with a deductible of insane amounts of money, and it's great for an acute or tragic incident. But as far as just health, which is where we're not focusing, I kind of like this concierge model. Do you prefer what you've preferred? I would assume, based on what you've said, this question may be a little bit redundant now, but between being a family practice physician versus concierge medicine clinic, and maybe that's a loaded question. I guess if family practice medicine had been a different way. There might be a way to address more people and the family in different ways. But I guess with the change, maybe your answer is going to be a loaded question. But family practice versus concierge, how would you paint
Well,
those?
there are a lot of concierge practices that are disease oriented. So you can have a fee for service practice um, that just deals with disease, and there are a lot of doctors that do that, and that people pay a flat fee for the year, and the doctor's available 24/7 for disease oriented issues like treating diabetes, or managing heart disease, managing blood pressure. My practice is more being proactive about preventing disease and focuses on lifestyle a lot more. But there are definitely traditional trained disease-oriented doctors that are doing concierge medicine. MD VIP is an example of they're all across the country. It's a concierge practice that deals with sickness and illness. Sorry, I got a printer going here.
Oh, no worries. So one of the other questions I have is in an age where doctors are still coming out of medical school, it seems, trained to react to acute or chronic illness with pharmaceuticals and with annual physicals where it's basically see you next time. Do you have any sort of recommendations, I would say, for the medical profession, but almost just for the universe? Like what's your wish that doctors would come out of medical school next year and start to be trained in, so this would work out better for the patient base of the next decade?
I didn't hear all your question. Well,
Like
okay.
what do we change? What do we change so that the next 10 years of doctors coming out of medical school starts to see it this way and not have to be retaught that? What do we change to make that happen?
I think we need to change and teach doctors about the value of nutrition. Doctors even today get very little training in nutrition and exercise. So we need to start teaching lifestyle. Hang on just a minute. Well, she just left. Thank goodness. I thought she was going to print out a whole novel there. Anyway, doctors, medical schools need to really start focusing on how to keep people healthy and how to keep people how to help people avoid disease. I didn't get that in training, and I've talked to doctors that just finished their residencies in internal medicine and family practice, and they don't get that. They don't get much training at all on how to prevent disease. And so the doctors that are produced today are really all about treating disease, and the whole insurance model is about disease. It's about you got to have an ICD-10 code to bill for a disease. Now they're starting to throw some things into the codes that help with preventing disease and counseling, but it's got a whole. Doctors do not get paid very much for teaching people lifestyle changes, for teaching people how to exercise, for teaching people how to eat right, and that needs to change. Then there's this whole area of alternative medicine that is ignored, which is really important. Acupuncture and all these other modalities that are very valuable, and we don't see that much in Western medicine.
I noticed that there's I'm not a big fan of federally imposed changes to the way that we do things in terms of medicine. The whole the electronic medical records platform, legislative intervention, I think was not the most successful thing for doctors. We can probably agree to that. But this new MACRA and MIPS incentive program is starting to, it seems, have Medicare imposing initially an incentive and now a penalty if doctors don't prove compliance with certain metrics or certain performance, in their practice. And I've looked at it, and I'm cautiously skeptical about whether or not it's going to move the right needles, or actually do something to get doctors to do what you're doing. Do you have any opinions on that? Do you think that's going to make a difference?
Well, I'm not really familiar with it because I don't deal with it at all. But
True.
so I have to talk to my son about that. He's in traditional family practice.
Yeah. What they're doing now is they're basically, they're following. It's almost like when you asked Henry Ford, what people, like people would want faster horses, and he said, that's kind of the wrong way to look at it. They're making doctors prove that they're following up on the metrics that they used to be not being diligent enough about. Did you get a colonoscopy? Have you done this reactive treatment? And I think it's well-meaning, but maybe not as well directed as what you and I are talking about tonight. So hopefully we'll figure out a way for medical schools and even post-medical schools to start teaching more about nutrition and lifestyle. And hopefully you and I are, joined at the hip in getting the message out there, even if it's in a small way. And with that, I'd like to just ask, maybe you can share with us what your guiding principles are to, what drives you every day, what makes you want to do this, and what do you think people should pay attention to in terms of their practices to get, their patients on the same path that your patients are on?
Well, the thing that drives me is that, I've kind of blazed a trail for the baby boomers through my own experiences, through my own mishaps, through my own really bad lifestyle earlier, and so I'm really become passionate about doing things that can help change people's lives for the better. And it's so hard to get people to really, medicine just moves so slowly. The things that are being talked about to prevent heart disease, it's going to take 20 years before they become part of the traditional, part of the mainstream practice of medicine. It just takes, it seems forever to get things to incorporate things that have been really known for decades from the scientific studies. It seems like it takes forever for them to become part of mainstream medicine, and it's just so frustrating. So the thing that drives me is my own personal health and well-being, my own experience, and then I get labs of my patients 3 times a year, and I see things that they've done that has really improved their labs, and so that just reinforces what I'm doing and what they're doing. And I just wish I could do more for more people, but I keep busy enough. I mean, I can't really take on much more than I'm doing. So through your app program, I'm hoping to be able to expand out even more.
Yeah, I wanted to touch on that as we conclude tonight, that, for anybody who's listening or watching this video, even in the recording, after the fact, Dr. Life has written, the life plan, mastering the life plan diet. He himself was the grand champion in the Body for Life Challenge. So he knows what he's talking about. He's doing it in practice and in his own life. And so in the Body Site marketplace, Dr. Life's program is available to his patients, both in clinic and also on the web. But if you're a provider and you don't have the time to build your own fitness program, or your own programs that follow some of these principles, it's noteworthy that Dr. Life's program is also available in the Body Site Premium Plans marketplace for a small fee if you want to reuse it. It's as a royalty to his creative production of it. And we're grateful, Dr. Life, to have you on our system. It's an honor for us to have you using us and espousing our principles of preventive lifestyle in terms of functionality with your content. And for anybody who's watching this and is a provider and wants to use Dr. Life's program, it's available within the Body Site platform. And we encourage you to use that if you're not already, pushing your own agenda for fitness, because he's got it mastered, and it's a great program. We've seen it, we've used it, and we are, forever grateful to have you on our system, Dr. Life.
Well, thank you, John. This has been great. You've provided me a great opportunity to really create something I've wanted to do for ages.
Yep, and I've got one question was somebody asked whether or not there's a fee charge when you assign to a patient. The answer is yes. It's a small fee. We can talk about it offline, but Dr. Life has created a program he sells, obviously for a much greater program fee to his own patients, and it's available to use in your own clinic for a small fee. And I'll talk to you about that offline if you want to send us an email to info@bodysight.com. And I think that was all the questions we had. Dr. Life, unless you've got something else that you want to add, I'd love to let you go back and enjoy your time in New York City, and we'll catch up to you again when we're both back in our desks at our normal offices.
I think I've covered everything. Julia is my business partner, and she's been listening. Do you want to say anything, Julia?
Hi, hi everybody. That was fantastic, John. Thank you. And Dr. Life, it was fantastic. So no, I think you've covered everything very nicely, and looking forward to being able to see this replay, and the fact that all the knowledge that you've had over the years will be able to be shared with others. So thank you, John, for this opportunity. We really appreciate it.
Awesome. Well, as a housekeeping matter, it's recorded. We'll be publishing it to our website. We'll give a copy of Dr. Life, as well as sending us out to our list of thousands of people who haven't seen this tonight that are on our list of clients and leads. And Dr. Life, we appreciate you again. And if you have any questions for Dr. Life, you can send them to him through his website, drlife.com, or to us at info@bodysight, and we'll make sure we get those answers to you as soon as possible. So have a great night, Dr. Life. Enjoy your time in New York City.
Thank you, John.
We'll talk to you soon.
Thank you, everybody.
All right, take care.